Welcome to Mental Health First Aid, our first show. We're so excited for being here and to teach you all kinds of good knowledge and information that we have. This is going to be a show that we're going to keep going with on a monthly basis. You'll be able to see it probably about once, twice a week, and we're going to bring in doctors and all kinds of clinicians and different people to tell you and give you the understanding of mental health issues. Today's show, we have a special guest. We have our Linden Oaks president that's with us, Lou Mastro. Lou, thanks for coming here with us. We appreciate it. You are the top person in the hospital, in the Linden Oaks Hospital, correct?
Yes, I am. Thanks, Barry. It's a pleasure to be here.
Oh, I tell you, we wanted to start the show off right and have our top person here to discuss it. And also, it's very important to have you here because you were sort of the designer of this, the idea, the goal setter for the hospital. So you have to come up with different ideas, what works, what doesn't work, and you came up with Mental Health First Aid.
Yes.
Where did you find it?
Well, I'm basically a reader. I like to scour the internet and read all kinds of journals about mental health. And I came across the Mental Health First Aid program and immediately went to the website and read all about the program. And I thought, wow, this is a program that really has the power to make a difference in our community, to really change the way individuals perceive mental illness and to help us carry out our mission of educating the community on mental health issues and really engaging in early intervention and early diagnosis of mental health issues.
You know, talking about mental health issues and stuff with Linden Oaks, what do we do at Linden Oaks? I just want to give the audience an idea of what we do there and what's happening.
Well, Linden Oaks at Edward is a behavioral health provider. That includes Linden Oaks Hospital, which is a 94-bed inpatient hospital. We also have 40 psychiatrists on staff at the hospital, including our Linden Oaks Medical Group, which is a group of employed psychiatrists. And we also have multiple outpatient satellites where we provide partial hospitalization or day hospital programs and intensive outpatient programs, which is when a client comes to us for 3 hours a day for psychoeducation and therapy.
Right, right. Very interesting, different ideas that come at Linden Oaks. My background, as you know, is police work, and I had an excellent reputation, you guys have had an excellent reputation with helping us with kids who needed different help at the time and stuff, and the police department would refer and try to get these people help, because that's basically what we did, was try to find help for people who needed it, and Linden Oaks was always there for us to be able to do that. Do a lot of the police departments use you, or?
Sure they do. We have a department called Resource and Referral, which is open 24 hours a day, 7 days a week, and this department is available to anyone in the community who may need help. We take about 6,000 phone calls 6,000 phone calls a month.
Wow.
And individuals can come in for an assessment. We'll do a level of care assessment and determine what type of service they may need. We can schedule appointments ahead of time, or if people are in crisis, they can just walk in and we'll do an assessment.
Right.
So we're actively engaged in the community. We meet with the schools on a regular basis. We're active in the faith community as well as with corporations within town, and so we really do try to get the word out that this service is available.
You know, doing some of the marketing stuff for Linden Oaks and talking to people about it, the faith community, you brought that up. It's sort of like people go to that really quick and they're sort of surprised that we're part of that. You know, wow, how refreshing to see that. Is it unusual?
Well, I think when you think about it, a lot of times when people have problems in their families or perhaps problems with their self or their mental health, they will go to their pastor or to their reverend or to someone within the church community. And so it makes sense for us to interact with those individuals to make sure that they have the knowledge and the information and access to resources to give them the professional help that may be needed.
Right. And with that, I mean, it fits into everything. It fits into geriatrics, it fits into children, it fits into adults, all different aspects of it. And it's a big part of the bringing it on. Absolutely.
At Linden Oaks, we have dedicated inpatient units for adults, adolescents, geriatric patients, and then specifically units for eating disorders and chemical dependency. So we're able to work with people on their specific issues and provide programming that is really designed to and tailored to meet their individual needs.
So I can see why this is a perfect fit.
It is a perfect fit.
It's a perfect fit for Linden Oaks. You know, something exciting happening right now, and I know it's off topic a little bit, but I know we're all very excited about it. We have new construction going on.
Yes.
at Linden
Yes.
Oaks.
We are in the process of expanding Linden Oaks. We are putting additions onto 3 of our inpatient units to provide more group room, consultation rooms, and day rooms, and then we'll be able to add 15 more beds to the hospital. And in addition to that, we're building a large outpatient facility, about 50,000 square feet, where we'll be able to provide lots of outpatient services for both adolescents and adults in the community, but off-site from the hospital campus.
Which works out really nice.
It works out well.
Yeah, and we also have a new building we're possibly looking at. Can we discuss that or not really?
Sure, we can talk about that.
On Mill Street, we got a new building?
Yes, it's we're putting all of our outpatient services on Mill Street, north of Ogden in Naperville. And again, that's 50,000 square feet, and we'll see clients with all kinds of mental health issues, including eating disorders, chemical dependency, depression, bipolar disorder, and anxiety disorders.
And what we're looking at with that, it's a very attractive, nice looking building.
It's a beautiful setting.
And I was just talking to you before the show, and you were telling me that we're gutting the whole thing and redoing everything, so it'll be brand new.
It will be brand new. We're completely gutting the entire interior and designing it so that it is very welcoming and provides the best setting for us to do education as well as therapy sessions.
Right, helps out. You know, the reason I brought that up, nice little segue here, back to mental health first aid, we're going to have a room where we can teach there.
Yes, we are. We're going to have a large community room because that's part of our mission. Part of our mission, again, is to educate the community on mental health issues. So we'll have a large conference room where we can provide education not just for professionals, because we do a lot of professional education at Linden Oaks, but also for the community, for all kinds of lay persons and different individuals from the community.
Exactly, that's right what we're doing here.
Right.
Perfect for it. I know with the building that we have right now, we do classes there. We do internal classes, I guess you could call them, at Linden Oaks for mental health first aid.
Yeah.
In fact, I think we've had 5, I believe, and they've been packed. They've been filled to the brim, and we have more people wanting this. Is there anything? What's attracting people to this? Is there? I mean, internally with our staff, they really want this. Is there one certain thing why they want this, or is there a couple of things?
Well, you know, mental health first aid was designed as a public education program. It's a 12-hour course that teaches individuals about the potential risk factors, the signs and symptoms of mental illness, and how an individual can respond and offer help until professional help is available.
Right.
It's really to help people who are developing a mental health problem or experiencing a mental health crisis. So originally, although the program was designed for non-clinical, non-professional persons, what we have found is that we opened it up to our own employees, both at Linden Oaks and at Edward Hospital, and the employees have really just loved the program. I think it's the difference between learning about mental illness and treatment as a clinician versus in mental health first aid, you're really taking the perspective of the individual and the family member. So you're really seeing the illness from a different perspective. And
We've got a whole show just on that.
Do you?
You know, we could talk just on that issue, what you just brought up there.
Sure.
I tell you what, when we come back, we're going to talk more about maybe some other issues with CEUs, why people are more interested with this too, and once we get them there, how much they like it. We'll be right back. Thanks.
Everyone has friends. There's online friends, friends to go out with on a Saturday night, friends to hang out with and do nothing, friends who show up on moving day. And then there are the friends who'll be there if someone is dealing with a mental illness. Are you one of those friends?
I remember how much you said you liked wine. Oh.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
The first step to getting into college is finding someone who can help. For the next steps, go to knowhowtogo.org.
Welcome back to Mental Health First Aid. We have a conversation going with our CEO, President of Linden Oaks, Lou Mastro, and we were discussing why staff is so interested in this and what works for them. And I tell you, one thing I learned with the CEUs, we didn't have to, as police officers, deal with the CEUs too much, you know, so it didn't mean much to us, but it's like gold to clinicians and nurses. Because why is that?
Well, because in order to renew your license with the state of Illinois every 2 years, you are mandated to have a certain number of continuing education units, which is a really good thing because we want to know that our clinicians are maintaining and are, you know, staying current with what's relevant in science today. So they're always happy to get the CEUs.
Yeah,
Sure.
and the CEUs, they have to have how many a year? Is it like 35 or something? Or
Good. I think depending upon your discipline, you have to have either 25 or 50 CEUs per year.
Wow. I know our chiefs of police, they had to have so many, but there's different CEUs.
Sure.
Which are police, nurse, clinician,
Sure.
therapists. In fact, we have 6 different types of CEUs that we offer. So a lot of people are very interested in that. And you know, that might be a hook to get them into the door, but I think once they're there, they really enjoy the class.
Oh, absolutely. And there are a lot of programs available to people to obtain their CEUs. So we believe that everyone who actually signs up for the class is actually very interested in learning about mental health first aid. It's not really just to meet the CEU requirement, although that's a nice benefit of the program.
And because we charge $25
Correct.
for the class, and that pretty much covers the book cost and paperwork, and everything else is, and they recognize that too, that it's very beneficial to them.
Yes, and we have been very blessed. Edward Foundation gave us a large grant to educate our trainers as well as to subsidize some of the mental health first aid training that we do. So we're able to offer it at a price that is so reasonable.
Right, and it really helps out.
Right.
But I guess we have to say our staff gets it free.
They do.
They don't have to pay for anything, which is really nice because internally handles it. And we even, during our staff classes, so if you're looking for a class and we're having one at Linden Oaks, I'll give you a hint. We do a meal with our staff, so you get a meal with it too.
Exactly.
So, which is a good deal,
Sure.
I mean, all the way around. So that works out well for all parties involved.
And it's another way for us to communicate to our employees how valued they are and how much we believe in this mission.
So the classrooms that we're doing it right now, that will change over to the Mill Street probably next year sometime or whatever, so we'll have a bigger class there we can work
Correct.
in.
We try to offer the programs in as many different locations as we can for convenience sake.
And we have like 8 different classes at this time at different locations happening all over. Just to give an idea of a couple of the classes, we have one at Elder Law in November. It's a firm in Aurora, and they're totally behind this and believe in it, and they're helping us out. And in fact, the president of the King County Bar Association is with Elder Law, and she has hooked us up with the Bar Association. We're going to meet with them and do a presentation and see if we can get some of our lawyers lined up with it, getting training. With that said, who is this geared towards? Lawyers and clinicians? Who else?
Mental health first aid is really geared toward, I believe, anyone. That includes family members and friends of persons with mental illness. That includes schools, both faculty and resident advisors.
Absolutely.
That includes law enforcement, nursing homes. And like I said earlier, we have found that healthcare clinicians have really found the program to be very valuable.
And a nice boost, I think, for them. That's what I hear when we do the programs. It's just a boost for them of energy and of information, and it sort of gets them going again, you know, which is really good to see.
And when we first learned about mental health first aid at Linden Oaks, we immediately sent 4 of our senior level directors off to be trained as mental health first aid instructors. In order to be a trainer, you have to attend a 5-day, 40-hour, pretty rigorous training program.
I did it. It's pretty rigorous.
It is.
Yeah.
And so when they came back, we realized that, oh my goodness, we don't have enough trainers. And so we've been really actively involved in recruiting more trainers so that we can spread this mission. We did have a meeting after our directors came back as mental health first aid trainers. We met with various leaders within Naperville, including the mayor, the city manager, the chief of police, the chief of The fire department, they were overwhelmingly supportive of this initiative, and so we're really working closely with them to train all of their employees.
Right, so that partnerships we're building right and left.
Right.
Talking about partnerships,
We
have a lot of partners.
We do
I
have a
mean,
lot of partners.
There are
and
so many, I got to get a paper here to
Good.
just go by. I mean, one was interesting here. The idea of the partnerships is what?
The idea of the partnerships is that we recognize that in order to really make a difference, in order to really change how the community perceives and deals with mental illness, that we had to train as many people as possible. And so we went out and looked for partners, including, as I mentioned, some of the city leadership. But we looked for partners in the community that were going to, A, share this vision with us and help us educate people about mental health first aid.
And try to keep costs down.
And try and keep the costs down, to do this as low cost as possible.
One of the partners that we have here is sort of unique. It's Country Inns and Suites of Naperville. How does that work out?
I did a training on mental health first aid at the Naperville Chamber of Commerce, which was very well received, and certainly we've gotten partners out of the chamber as well. But Country Inn and Suites, their representative was there, and they were so impressed with the training program that they offered and have allowed us to provide the trainings at their facility at no cost.
That's awesome.
So it's a tremendous partner.
Yeah, that is just so cool. Looking at all different avenues of this, trying to keep costs down.
Correct.
And with, I know that's where we had our Train the Trainer class was there.
Yes.
I mean, we were there for 5 days, and it was free, which is just, I can't say enough about that.
Sure.
We have so many other, I mean, from Alden to Bridgeway Christian Village, DuPage Regional Office of Education, Edward Health Fitness Center.
Sure.
How does that fit in? I mean, they help out with, they have their staff, they train them.
Sure, they train their staff as well, and they've found the program to be very helpful as well.
And whenever we can think of something we can use the fitness center, it'd be awesome too.
Correct.
I mean, you know, as
Correct.
a something they could get or work towards or something. I mean, there's all kinds of different avenues with all the different partners that we have here.
Sure.
NAMI
well,
will.
exercise is really important with mental illness. So they have really, the fitness center has been a tremendous partner with Linden Oaks, and they will do exercise programs on site for us, and also allow some of our patients, for example, the clients at Arabella House, which is our eating disorder group home, actually go to the fitness center to work out as part of their treatment.
It's just awesome to have this big family together that will be able to utilize different aspects of it to help
Correct.
each other out.
Correct.
Which is just really neat. I mean, and there's all kinds of others. Senior Star Weber Place, we have a class there right now. Teen Parent Connection, Veterans Assistance. We are having a, there are different curriculums out. They're working towards different curriculums right now for mental health first aid, specifically to deal with police officers is one.
Correct.
And veterans is another one. You know, and you know, and I can say this because I was one for a long time, for 30 years. Coppers are hard to teach. I mean, and the reason being is they have so much armor built up that they don't want to really touchy-feely stuff, you know, it's just a strong thing that they have to work towards. So they're having a special curriculum just for them to get this across, because who better to teach this to?
Exactly, because they're often the first responders when someone is having a mental health problem or a mental health crisis.
Absolutely. We're going to be back in our next segment, and we're going to talk about the different avenues of why it's so important to talk to different places and different people about this training, and what it means to them, family members, co-workers, and a lot of other people. We'll be right back.
It begins innocently enough. You don't return a phone call. You break a date at the last minute. But in fact, it's the beginning of a pattern. And soon, your friend with mental illness realizes you're avoiding them. But what if you knew that your friendship was the key to their recovery? Would you still lock them out of your life?
Whatever we deny or embrace, for worse or for better, we belong together.
Underneath everything we are, underneath everything we do, we are all people, connected, interdependent, united. And when we reach out a hand to one, we can influence the condition of all. That's what it means to live united.
Ready. Ready.
It can be a little awkward when your friend tells you he's been diagnosed with a mental illness. But what's even more awkward is, if you're not there for him, he's less likely to recover.
I'm here to help, man, whatever it takes.
Welcome back to Mental Health First Aid. We have a segment now we want to talk about who does this help and why does it help? I guess who does this help, Lou, in effect of, is it just certain people that have issues, or is it those people, or is it somebody?
Well, I think it's important to understand that mental illnesses are very common. They're so prevalent that we know that in the United States, every year, 1 out of 4 Americans will experience a mental health problem. And over the course of our lifetime, half of us will have some type of mental health issue.
So it's not those, it's us.
It's us. It's
right.
us. It's all of us. And so it's very prevalent. I think the thing that is most disturbing is that because of the stigma that's associated with mental illness, we know that something like 50% of adults and over 70 to 80% of children and adolescents who need help don't get the help that they need.
Right.
And so what we need to do is help increase people's understanding of mental illness and then educate the community so that people can receive earlier diagnosis and earlier treatment.
Right. I mean, as a person out in the street working with different people, working with different agencies, it was so obvious to me, and I tell you, I wish I had this training earlier in my career, because it would have helped me so much more to understand what was going on. That's why it's so important to get the police officers trained with this. It was so obvious to me how much it was hurting people with the stigma involved.
Sure.
It was making it 10 times worse. You can't even work on the problem until you can get rid of the stigma.
Well, I think the basic issue is that people just don't understand mental illness and they don't know what to do. So for example, if someone returns to work and says, you know, I was just in the hospital, I had a hip replacement, everybody knows what to do. They ask them how they are, how's the recovery going. If someone came back to the hospital or came back to work and said, gee, I was in the hospital, I was hospitalized for depression or a suicide attempt, no one knows what to say or do. So there's this social distancing that occurs and makes people feel isolated and lonely and not want to discuss what's going on with them.
Which makes it even worse than that they can't talk about it and make it better. You know, it was something that we discussed during training and stuff, and they did an example I thought was very interesting. They said what cancer was 20 years ago. You know, the C word, don't even say it, you might get it. You know, that kind of attitude with it, and it was like hidden. Oh, they got cancer, they died, you know, and now you say cancer, let's fight. Let's go.
Correct.
We're ready to fight for this. We can do this. We can beat this thing now. You know, it's just so much more of an awareness. That's what we're trying to do for mental health issues.
Sure. We're trying to help people understand how prevalent mental health issues are and that they are true medical diagnoses. They are true brain disorders. This isn't a lack of willpower or you know, any other character weakness that a person has.
I know the films that they show during the training, the 12-hour training that we have, are very, very strong and put you at, wow, I understand that because that looks like my mom or that looks like me or there or whatever. You know, when they're talking about depression and stuff, and it makes so much more sense to you as going through it. I know there was one portion that they did with the psychosis part, where they talked and the person in the ear had a rolled up paper and they'd say, you know, don't believe them, don't listen to them, they don't know what they're talking about. And you're trying to have a conversation with that person and the third person's doing this. And I don't know why, but that clicked with me so much as a police officer.
Sure.
Oh, I get it. That's why they were acting that way. You know what I mean? That you can't keep your concentration. You can't understand. You start laughing because you're just going, cut it out, you know? And it just made perfect sense to me then.
Absolutely.
It's just so powerful, this class, to understand these different things.
And mental health first aid teaches individuals about, again, the risk factors and the signs and symptoms and what it's like to have a depressive disorders, anxiety, psychotic disorders, eating disorders, and substance use disorders.
Right.
So it's a tremendous education program.
Across all entities. And that's just the brunt of it, and then sort of goes off in different directions with that too.
Correct.
So it's very interesting that way. We have an organization that I'm sort of embarrassed, I didn't even know of this I don't know, it just wasn't in our circles or whatever, is NAMI organization. What is NAMI?
NAMI is the National Alliance for Mentally Ill, and it is a consumer advocacy group that provides support to individuals and families with mental illness. And really, they do a tremendous job of advocating at the regulatory level, and also just providing support services to families. There's a national association for NAMI as well as local affiliates. And we work very closely with our local affiliates in DuPage County, Kane County, Will County.
Right. And in fact, we have instructors from DuPage County that went to the instructor school with us.
Correct.
Will County and DuPage County, NAMI's we're starting up. Mary Dalton's got a class going. Tina has got a class going from our Will County NAMI. And we're real excited about getting involved with those classes also. And it's something with the, we were at the Chicago conference also. With the NAMI conference, which is very, but like I said, I'm sort of embarrassed as I never heard of it before. You know, it just sort of comes, something you learn in a new job and understanding what different entities and stuff.
We have a very close partnership with NAMI, and we try to transition patients from our inpatient and outpatient programs to NAMI, so they get ongoing support in the community after they're discharged from our facility.
Right. The other agencies that we're working with, talked a little bit about College DuPage. We have a contract with College DuPage where they are running the class. Well, I guess they're registering the class. We are running it with instructors. And we also broke the barriers with the Northeast Multi-Regional Training, which is NEMART, with police officers. We were able to get in there, talk to them, show them our curriculum, write up proposals, explain the process to them, and we were able to get in there, and we're going to be teaching police officers in February, which we're really excited about.
We are. That's just terrific.
Charla Waxman, one of our, in fact, my boss, she is a gang specialist and has the police officers respect her quite a bit, you know, what she knows and what's going on. And myself being a police officer, we're going to be teaching them and to try to get our foot in the door and to be able to work with the different people. And the other places we're looking at right now, we're working with NIU, presentations, trying to work with them. In fact, we have Math and Science Academy, their RAs are going to be in our class, which we're real excited about. State of Illinois is having a little bit of money problems, issues. We were able to get a grant together through our National Council. And in fact, it was a $1,000 grant, and Edwards matches it.
Correct.
So we have that money where we can use, and in fact, our RAs at Math and Science Academy are going to be using that to help them.
Sure. I'm really excited about our student and school affiliations. I think that if, you know, we want to change the way the community perceives mental illness, I think it has to start with the next generation. And the more we can educate students, particularly at the high school and college level, I think that's how we begin to start making changes.
Yeah, right on. I tell you, we are so excited about this at Linden Oaks, and I tell you, I'm so impressed with you, Lou, to be able to have this vision for us. And I mean, just to be able to read up on this thing and understand how important it is, you hit a home run.
Thank you.
Thank you very much for being on the show. And thank you for coming and listening to us. I think it's very important. Shows coming up where you have clinicians, doctors, all kinds of different people here to discuss depression, anxiety, eating disorders, psychosis, all types of chemical dependencies. It's stuff that's really to help everybody, to help all of us. So thanks a lot for being with us at Mental Health First Aid, and we'll see you next week.